he was in intensive care in regional, and he had the vent, and he had a feeding tube up his nose, and he was literally flat on his back, not being able to do anything. They had no place else to go but to go to this special unit that caters to people on ventilators.
It's a very sophisticated unit, very specialized unit, taking care of the very intense pulmonary patients. Two main goals. One, if they come here on a mechanical ventilator, a life support machine, is to what we call wean them off the ventilator and then take care of all their other needs. And those other needs are physical therapy, occupational therapy, nutritional, wound care, speech, nursing, and social service. We will have a team meeting with the family members. All of the family members will discuss what is the patient's outcome, what are the goals for the patient, what are the goals for the family, and of course the discharge planning. And the first protocol is we take them off the machine completely. We see how they breathe on their own. Once we see if they can breathe on their own, then we can make a decision to continue them off that machine. Maybe 1 or 2 days, depending how they do. The next goal would be taking the tracheostomy tube out.
Within 2 days, they took out the ventilator and started weaning him immediately, and it was unbelievable. They were so aggressive and so successful. They took the feeding tube out. They gave him the swallowing test. I mean, and now he's up to walking up and down the halls. So I'm quite proud of him and the hospital for doing whatever they could to encourage him and I.